Joining us, as she so graciously does every Monday, Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you again for being here. Okay.
Thank you for having me.
Of course. We continue to see this rise in the number of cases and the number of deaths go up. You know, it's just a reminder that the decision to request a second mobile morgue for the health system last week, the cancellation of non-emergency surgical procedures, which we have seen in the past. Talk a little bit about the steps your team is taking to try to stay ahead of this surge that may be coming.
Yeah, so all of these things that we're doing right now are really to plan for this surge. So, you know, we still expect that to come. So we're watching the numbers closely every day. We're working with our data team to look at projections. So every decision we're making is in the shadow of what is going to be our worst case scenario. So that's really what we're planning for right now.
And later this week will mark kind of the 2 weeks since the Thanksgiving holiday when you're expecting more cases to come about. What are you still expecting those numbers to rise at that time?
We do. So, you know, numbers today are high. Numbers that, you know, that we're starting to see to come out tomorrow are certainly high again. You know, our data team still projects, even within a week, to be between 300 and 350 patients. So we fully believe that, you know, if the cases proceed like we think they will, that we'll continue to see a burden on our health system.
Well, the vaccines, we are told, are coming. Are you still on track for receiving those for your frontline workers in the next couple of weeks?
Absolutely. So we are full steam ahead in planning on our vaccine distribution clinics. So that really is consuming most of my time now as my team kind of steps up and carries the workload of positives. I've transitioned to almost full-time vaccine planning with another large work group. It will certainly be an all-hands-on-deck response for Ballad Health.
Well, there are some that are saying, you know, I just don't know about this vaccine. It's been, you know, run through testing and studies and everything else, and they may not take it when it becomes available. What is your message to those people who may be doubting?
Yes, I really understand. I completely understand their doubts and their questions, but I encourage them to get those questions answered, to go to a reputable source, read about the vaccines, talk to healthcare providers, you know, get your questions answered. So there's a lot of information out there, but there's a lot of misinformation. So you really want to make sure you're getting the information from a reputable source, understanding that, you know, this vaccine went through all of the same safety measures. Things just happened simultaneously instead of one after the other. So that's how they were able to speed up. You know, the FDA meeting is Thursday. So really, you know, listen to what the FDA says, the ACIP guidelines as they come out. So just take the information and really dig into it and ask for help to understand it.
Well, Thanksgiving is behind us. Christmas is coming up. I know you had a lot of recommendations for people when they were celebrating Thanksgiving. Any of that change for Christmas potential celebrations?
Unfortunately not. You know, CDC is already coming out and saying, please don't travel for Christmas. And I understand it's hard. You know, like we've talked about, I've got kids at home. I've got extended family that want to travel in. But it's going to be really important that people really kind of take that same approach of celebrating with those in their household.
We had a time where our cases started going down, and it was really a bright spot. We were like, okay, you know, something's happening, we're doing something, and then all of a sudden, you know, these surges are starting again. Is there any light at the end of the tunnel? Is there any point at which we can say we are on the right track and we are heading, you know, toward the light?
Yeah, I mean, it's going to take a couple of things. So certainly vaccine uptake. So, you know, it's not going to help us just to have vaccine. We have to give vaccinations. So certainly the quicker we can get more people vaccinated, the better we'll be. That's going to help in this response. The other thing I just want to remind people is I'm starting to hear, well, everywhere I go, I wear a mask. You know, it's great that as we go to the grocery store, everybody's masked. That's really important. But what we're seeing continues to be that spread in those small groups, dinner gatherings, birthday parties, you know, people that you feel safe with. But when you're intermingling 4 or 5 households, that's really the risk, and that's really what's fueling the fire right now. So that's what we need people to do, kind of limit those gatherings, stay within your immediate house, and just try to really limit any outside exposure at this point.
It's a lot to ask, especially this time of year.
It is, and I understand. You know, this pandemic is not going to go on forever. We can slow this down right now. So you know, if we try to stay home, try to limit our outings, slow this down, help our health system, get the vaccine, there is light at the end of the tunnel if we can do all those things.
Jamie Swift, our Chief Infection Prevention Officer at Ballad Health, thank you again for joining us.
Thank you.